And what we've got for us as an audience, so listen very carefully. There'll be people here with products and ideas that you might want to pick up. We've got a timer on the screen. So when it gets to 35 seconds, so 1 minute 25 seconds of the pitch, we are going to start clapping. Now this is a technique that we've learnt. We run hackathons based on the Massachusetts Institute of Technology methodology, and when they want somebody to sit down, they start clapping. So it's a nice sort of round of applause. You've done really well, but it prompts you to think, gosh, I've got my last 5 seconds. Right, is that okay, Catherine? Will that work?
Yeah.
So,
yeah, I'm just sorry I can't reduce it to
Okay. So when we get to 35 seconds on the screen, start clapping. Colleagues, you have 5 seconds to wrap up. Race off for the next person coming in. Okay? Yeah, so this is a challenge. We'll see how it goes. This is like a marathon. So who have we got up first, Catherine? Does it matter what order we go in?
Don't introduce anyone.
Right. So over to you. Right. First colleague want to come. Very brave person here.
There you go. And we're off.
Hi, my name's Adrian, representing a company called Medipad. Medipad enables medical professionals inside the hospital. So we work on mobilising the existing legacy systems on technology such as iPads. We also have a patient monitoring solution. So we were the first medical app on the iWatch. We integrate into all of the wearables. So to answer some of the questions that have appeared today, patients' apathy is a massive challenge. So for us, it's not about getting the patient to enter information. It's about using the next generation of wearables to capture that information automatically and share that with its other medical professionals.
Can I have your extra minute?
Yeah, sure.
Hello?
Oh.
Ready?
Oh, I'm ready. Oh.
Hi, I'm Mike Panzowski from ASCOM. We focus on critical communications for hospitals and environments like that. We create the environment and also we bring critical alerts to clinicians. We basically are passionate about moving away the technology from paging all the way into the new world, so new environments such as Wi-Fi and bringing actual critical alerts to the caregivers. If you look in the fact that mobility will actually increase productivity by up to 20% of clinicians, and also the fact that we, as the nursing community, only spend around about a quarter of our time with patients. There's two important parts there which we actually try to actually do. So we, as a barrier, we actually found also that consumer-based technologies are great for displaying, intuitive, etc., but they can be lost, stolen, broken, etc. So as part of our barriers, we actually created some of the aspects which are actually smartphone technology that's based like a tool that you'd expect a professional to have. So that's me at ASCOM. Thank you.
Switching it off, that's not fair. Are you okay?
I think so. I'm Anna Jackson from Rally Round, and we are on a slightly different approach to everything you've heard about today, very clinically based, but we link in a lot with what Michelle's been talking about around well-being, around prevention, and around people taking a lot more responsibility for their own care. It's about keeping people living safe and well and independent in their own homes. So it's a circle of support with an electronic to-do list, basically, and it's an ideal tool for a lot of the systems and schemes that people have already got running, so home from hospital schemes, reablement schemes, anything to do with risk stratification where you're identifying patients and then care planning with them. Rally Round gives you an opportunity to build up a network and a to-do list around those patients so that once your time-limited intervention of 6 weeks, 12 weeks, whatever it is up, those things that you've put in place will keep going. And it can be anything from transporting patients to appointments, remembering to take the rubbish out, picking people up to take them to events, going out and helping them with shopping. So it's a whole range of tasks that people can engage with, but it's very much a tool for use in a service that you've already got running rather than anything that's an additional to do. We know people don't have much time, so we want to build it into things that people are already doing. So if you're already doing care planning, you're already doing assessments, then Rally Round's the tool for you.
Hello everyone, my name is Howard. I'm from a company called In Healthcare. And what we do is digital health solutions. I've got a nice slide I usually show you, but what I'll describe is, you've got your patients sat in the community, in a home, in a care home, with families. They are producing data. We've heard lots about data being produced today. It can be as simple as something from their weight from the weighing scales to really complex data that's collected by an app. What we do, we collect that data, which sits outside in the cloud or in the ether, and we bring it into the N3 environment because we're embedded in the N3 environment. We then take that data in real time, we provide it to the clinical teams because we are a clinically led solution company. The clinical teams can then review the data, make decisions and act upon it, either externally or actually feed more data back or information back to the patients. So for example, a team can dose an INR self-testing patient remotely, see what their readings are, adjust the dose, send it back to the patient. No individual involved in that communication. Because we're embedded real time within the N3 network, we can also upload all that data into GP clinical systems, such as EMS System 1 or any others that are out there. The type of services that we're involved in is remote INR, under nutrition, pain, which you may have seen some stuff around in Leeds, which I think you'll hear about in a minute. Also, we do a lot of work in care homes, in trying to embed vital signs, under nutrition, COPD, that sort of stuff. Anybody more information, come and see us over the back of the room.
Can I plug that in?
Okay.
Is that all right? I've asked for a screen. She's not happy with me.
I'm knocking this off your tab.
So I'm starting now and you can... I'll even start myself. Does that come up? Yes, wonderful. My name is Phil Coffin, work for Appetize Health, Head of Strategy, work around about a dozen trusts at the moment. Quickly telling you about a 2-year project within a minute and 20 seconds now. You might have heard of the Pocket Midwife, looking to standardise education but localised support. Been a great project. Our first trust was working with this on Nottingham. The idea is it's all been written by UK midwives, so it's real USP for us. It's got national support from the Department of Health. I'll come on to some of the awards in a moment. Obviously we're involved, Nottingham's a trust and their charity is supporting the funding. You can download the app on the App Store at the moment on iOS and Android. There's tons of features, so we customise the trust. There's great journey for 41 weeks about information each week to engage in the application. Leaflet gallery, tons of savings on the application, full list there. A few of the visuals, engaging with the app, really good user experience. We've done loads of workshops and focus groups over the last 12 months. Really benefits evaluation, so I mentioned earlier on. This is a real hard cost, so leaflets you can save up to 25 grand if you put all your leaflets on the app. There's obviously secondary soft efficiencies on there as well. There's a whole new feature, exciting roadmap, so digitising the maternity records, which is massive improvements. Thank you very much. Any more information, come and see me. Cheers. Thank you. Thanks very much. Cheers.
Okay. Do you want to do the next person that's on here? Yeah. Okay.
I've got no slides, you're okay.
Are you sure? Yeah. Okay.
Just got my phone.
Okay, then let me put my timer back on.
It's like countdown, isn't it? A minute?
I won't take that's mine. Go.
Hi, I'm John from Innovate Solutions. Just wanted to ask a question, really. Have any of us ever turned up at a hospital, either as a patient or a visitor, or even as staff, walked through the front door and then proceeded to get completely lost? Yes, I do it all the time with the wife. The good news is we're an app development company and we've developed a wayfinding app that basically works like Google Maps but inside the hospital. So you select where you want to go in the hospital and you're then presented with a list of easy instructions to follow with photographs at key points, so it's very easy to find your way around the hospital. The app itself is on the app stores and it's completely self-contained. You don't need Wi-Fi, GPS, Bluetooth or even a phone signal. Once you've actually downloaded the app, it just works on your phone, simple as that. We're currently piloting it with Southport and Formby Hospital and their version of the app will be on the 2 app stores end of March. We're working with 2 other trusts in the Northwest and one in West Yorkshire and one in Birmingham, where they want to roll it out once we've proved proof of concept in Southport. As well as having a wayfinding in the app, it has also got information about how to get to the hospital in the first place, links to Google Maps, buses, trains, lists of facilities within the hospital like cafes, restaurants, car parking, which is always a bugbear for the trusts. And I'll leave you that thought. I'll be there at the bar if anyone's interested.
Thanks. Are you just on the timer? Right there with me.
Hi, I'm here to introduce to you our Linkus app and Linkus web products that help people to better manage their health. Linkus is built to allow people of all abilities, languages and illnesses to record and manage their own health and social care history. My name is Adi Blanchard and I'm responsible for Linkus deployments, research and testing. We are currently deploying Linkus for people with complex needs in combined health and social care in the Liverpool City region, for people with diabetes in the west of England and Greenwich CCG, and for people with learning disabilities throughout England. We continue to co-develop and adapt Linkus for these and other NHS, local government and provider partners, and have a strong presence in the North West. User studies have shown that Linkus continues to result in improvements in perceived mental well-being and overall well-being, helps identify useful and negative interventions, improves engagement and communication, and enhances lifestyle outcomes. Work with the Liverpool YMCA, Linkus has nice recognition as a tool for behavioural change and is also a CE marked Class 1 medical device. Linkus is available on browsers at www.linkus.eu and as Linkus Lite on the Android and iOS app stores. Our commercial service packages range from annual reporting through to life coaching and support services that interoperate with multiple third-party services and systems. Please let us know if there's anything you'd like to talk about.
Thank you. Thanks. Right. So, are you just doing it?
Yeah.
Bear with me.
Okay. Hi, I'm Lynn Donovan. I'm from Citrus Suite. We're an app development company. We do create apps for other people, but we have created some of ourselves. We're actually working on Remind Memory Suite at the moment, which was co-created with Innovate Dementia. They all, a big group of Innovate Dementia actually was working with the app developers. So they actually decided what was going into the app. So little things like we've been talking about before, calling a tablet was not appropriate for them, because obviously they thought a tablet was something you take. So then obviously terminology had to change within focus groups, and that was all taken on board. The app is actually being tested at the moment with Merseycare, East Cheshire, NHS, and also adapted to the Chinese wellbeing in Liverpool. So it's all been translated into basic Chinese. It's still being developed. It's an app that actually helps people with dementia stay in their own homes, and it also helps the carers look after their family members, really. So there's an admin version of the app and also the app for the people with dementia as well. It's working really well. It is basically, you put your day into the app, and then there's just alerts and reminders. You can put everyday objects in there as well. Thank you.
Well done.
Hi everyone, my name is Catherine. I'm here from the Stroke Association. A stroke is otherwise known as a brain attack. It happens when the blood supply to your brain is interrupted, and the effects are immediate. They can be devastating, and they can last a lifetime. There are over 152,000 strokes in the UK each year. That's about one every 3.5 minutes, and 1.2 million people living with the long-term effect of stroke. Average figures state that stroke survivors on average receive about 4 hours of face-to-face care with health professionals. So really, self-management of this long-term condition is a priority. So the Stroke Association is committed to supporting people to have a great life after stroke. So with that in mind, we work with stroke survivors to create the My Stroke Guide. It's an online digital tool, a self-management tool. And on it, there's a wealth of information that is accessible and simple for stroke survivors and their carers to see. There are over 200 videos featuring stroke survivors and health professionals outlining all the different effects that might happen after your stroke. There's a goal-setting site. There's also a social forum which is easy to use, friendly and managed by the Stroke Association staff, which really, really reduces social isolation. It's currently available for over 500 stroke survivors, and we're getting excellent feedback. It's available where it's commissioned by local authorities and CCGs, so we really want to try and get it commissioned in more places. We're over there if you want a demonstration.
Yep. Hi everyone, I'm Andy, this is Kate and that's Vicky. We're from D2 Digital by Design. D2 is an award-winning digital production company based in Manchester, and we're going to talk about one of our digital behaviour change tools.
Imagine being able to keep in touch with service users every single day, monitor how they're doing and offer support when and as they need it. Services don't have time to do this, and this is getting even less. This system is designed to do just that.
The system Kate's talking about is called Evie, and it's an SMS text messaging system. It's designed for drug and alcohol treatment services and is designed to be used with the patient post-detoxification. It's been used in treatment services across the country and has some success rates that are brilliant in terms of reducing relapse and preventing and supporting re-engagement rather. D2 have developed a number of digital tools as well as this one to support people in their health and well-being. Some have been managed through services, some are self-help tools. As a former commissioner myself, I can tell you that these have had significant impact in terms of reducing demand and pressure on services. We're over there around the corner. If you'd like a demo of Evie or to talk to us about any of our other tools, please come see us after this. Thank you. Thank you.
Right, thank you very much. Oh, can I have the extra 10 seconds?
No.
No. It was worth a try, wasn't it? Right, hello, I'm Steve Bazier, ex-chief pharmacist for NHS Trust. I'm here with Miss Stewart Informatics and our product Maps. Medicines, as we all know, are vital parts of treatment. If you get drugs right, everything goes fine. If you get them wrong, it can foul things up. 5 to 8% of patients of readmissions to hospital are due to readmissions due to medication errors. What people really need to take medicines correctly is what does it do, what are the main side effects, what side effects do we need to worry about, and what are the do's and don'ts. So what do? We give people these stupid things. Absolute rubbish, aren't they? Different sizes, shapes, you can't read them. All people read too much into them. I'm trying to get a mess there. Or they read every single word of it, but they're legal requirements. Our solution is to produce one leaflet with the essential bit of information, so that's 3 drugs. If I had the slide, it would have Paul Lambert's name on it, bearing in mind where we are. And so what we've got an application that will produce a single document with all the essential information so people will be able to take a drug. You can archive it, you can translate it, you can have an avatar read it. It's white label, so it can be whoever subscribed to it. It's 24/7 free access, and it's essentially what a healthcare professional would say to somebody, only they can take it away in writing. We've got the clinical governance to go with it in terms of research, and we've already got a choice medication website, so we've got some experience. Thank you.
Oh, wrong way.
Good afternoon, everybody. I'm Richie Bowden from AssessPatients.com. We provide a secure, flexible care pathway solution to enable older people and their multidisciplinary care team to collaborate together on planning, assessing and tracking care needs. Basically, why are we doing this? Well, the major impact on the older community is the whole urgency of long-term conditions. It's never about any one long-term condition. It's about being able to manage a multiple set, be it dementia, be it loneliness, be it falls and frailty. And if we take one, falls and frailty, we see the impact of that. Last year, falls and frailty in the older community caused 4 million bed days, and the care after admission was a quadruple or 4 times what it was the admission cost. So what we're looking to do is enable multidisciplinary teams to define their own care pathway, incorporating community, outpatient and hospital-based services, and also generating quality of care metrics for the program management team so the program can be managed much more effectively. And finally then being able to communicate to the most important people, the older people and their friends and family. In our work we have two principles. Basically, first is we believe in co-creation. So for example, we're working with the Equip Research Centre in the University of Manchester on mental health and wellness and care planning. And the second is, this is very much about a partnership. So we're working with companies like Red Ninja and Tigra through our open API to pass information to the older community. We're just over here on the left and we're at assesspatients.com. Thank you.
Very much. Hi, my name is John Callahan and I'm from Damaboo. We make software. I suppose more importantly, I'd say we try to solve problems. Not every problem in the world, but maybe just focus on a little problem and try to solve that really well. You might know some of our apps. We made one called My House of Memories, which was a reminiscence therapy tool for people who were living with dementia. Not just for people who are living with dementia though. I use it with my nan because it's a really good just talking prompt to get to know. I'd never really felt like I'd spoken to her in that way until we started looking at some old photos from the 1950s, and it was an eye-opening experience. We set up a lot of test groups, patient test groups, to develop that app. We're really proud of where it's gone so far. We're about to release a new app. We've got a launch event tomorrow with Cheshire South, Cheshire East and Cheshire Council called Catch, Common Approach to Children's Health. And that's an app aimed at parents who might be having their first child, and it's tackling the issue of how do we share information with people without kind of making them feel overwhelmed or bombarded. So that's out on the iOS store, and go check it out. If you have a problem and you want to have a chat and talk about whether we can solve it or not, then come and grab me and we'll see what we can do. Thank you.
Hi, I'm Stephen and I'm here for PUFL today. So PUFL stands for Pathways for Life, which, is that better? Can you hear? Which stands for Pathways for Life, and it was something that was, before we even began, we carried out a massive piece of research to find out, do people actually want to take more control and more responsibility for their health? Turns out they actually did. They told us yes, but we don't know how to do that. They told us we don't actually trust local authorities, so whatever you do, do not brand it with that. And they also told us de-silo us. I'm sick of having to go to 17 different places for 17 different things. So with that, we then took that and decided we needed to do a citizen-centric approach. So it's an online platform predominantly. It is also offline. We started with the lifestyle, so we co-created that with Wirral, and we started with alcohol, healthy weight, healthy eating and activity. It's a place where you can go and set goals, you can track. We've now moved into long-term conditions, so we've got condition management, particularly for COPD, asthma and viral wheeze, and we've got diabetes coming as well. But more importantly is the connecting people with other people who are in similar situations, so it's that community aspect. That's what's really key for this. It just puts you in contact with others who are in a similar situation, so you can really support one another through that time. That's it in a quick nutshell. If you want any more information, feel free to come and ask.
Hi, I'm Francis from AliveCore. You've heard so much, I'm sure it's all going to blur. So I want to speak to parents and anyone who might be a parent or think about it. AliveCore, we have 2 kids. We've got some more on the way. And these kids are special. They are machine learning algorithms. Hey. And all they do all day long is study electrocardiograms. And do you know what? The 2 that are coming up 2 years old are now able to read electrocardiograms as well as your average doctor doing a manual pulse and then a 12-lead ECG. This is all embedded in the smartphone for anybody to access for themselves. So if they feel palpitations, they feel unwell, they have a curiosity, they have a long-term condition, this is really happening. And these babies are growing up fast and soon will exceed the capabilities of the doctors. And that's coming from Silicon Valley to the Northwest Coast AHSN, and I thank you for your support. And it's in thousands and thousands of patients' hands right now in the UK. So thank you.
Hello, I'm Andrew Michelson from Care Innovation, here to talk to you about our app Support Space. Support Space is a marketplace app for health and care services. It is modeled on apps like Airbnb, Uber, and Match.com, and it's co-created originally by disabled people. And disabled people told us that they really dislike applications like Circles of Care, which treat them like a footballer instead of a player in the team, which is what they wanted to be. Support Space allows service users, allows patients, allows their carers to accurately find approved workers, providers and personal assistants when they need them and where they need them, and to then arrange their own care and their own bookings online. Support Space is part of the Care City NHS England test bed, we're very proud to say. It is also a finalist in the Nesta Inclusive Technology Prize 2015, which we have our fingers crossed on that. We're one of 10 national finalists. It takes significant cost out of both the delivery and administration of health and care services, and I'd be happy to talk to you about that offline and give you more information about what we do and how we do it. Please do make a point of talking to some of our wonderful partners here today as well, like Citrus Suite, like ResCon, like Ames Grid Services, and others who we're very proud to work with and be associated with. Thank you very much.
One more, sorry.
I'm just putting a video on actually, thank you. I'm just actually going to put a 2-minute video on which can be cut off those few seconds beforehand. And I feel a little bit cheeky now because when they said a 2-minute pitch, I had this cut down to 2 minutes and wasn't aware that we weren't allowed to have anything on the background. It wasn't something that I picked up on. So you'll see a little bit about Maggie and Pain Sense, and I'm at the stand at the back, so as soon as we can move forward.
Oh, that's not happening, is it? Really got any sound? Don't know. Okay, well, that helps.
From the Halton area of Leeds. It's low back pain, which started, first of all, 50 years ago when I had my first child, and was spasmodic until 4 or 5 years ago when it seemed then just to kick in, and now I just have it permanently, and it's just grown worse and worse. I've had different medications, I've had spinal injections, I've had osteopathy, I've had craniosacral therapy, physiotherapy, acupuncture, been through the whole gamut. So if there is nothing else anyone's tried that is helpful, you're left with this fact that you have to manage the pain, you have to accept that you've got it, it's probably not going to go away, and so you have to manage it yourself, and this teaches you how to do that. Well, using the Pain Sense app is very easy. You can get into it within a couple of days from starting using it, and you find every time you go back onto it, it's very simple. I've had no problems at all. I think the main thing is it puts me in control. If, like me, you've been told, well, there's not much more we can do for you in the way of treatment, but now we want you to learn how to manage your pain yourself, then this is an excellent way of doing it. I can see by filling in all the assessment tools, by filling in the diary, that I do have an odd few bad patches, but in general, the things it suggests that I do when I've had an assessment are gradually helping me to get that little bit more in control and manage it myself. It's very personal to you. Yeah, I suppose I do like talking to a person, but this is a really good stand-in. This comes a very close second, and it's monitoring me when there's no person around.
Well, thank you, everybody. And what a great way to end our seminar this morning with all those fantastic ideas from colleagues around the room. So do take people up on offers, go and see them, think about how you can use the products. And thank you to everybody that gave those pictures. They were absolutely brilliant. Thank you.